Hi, we are the new and improved Team PIG, and today we bring you Health Galaxy, AI-enabling healthcare applications.
If you've been to the airport recently, you might have noticed that there's been a massive uptick in efficiency. A lot of this can be credited to the implementation of AI. For instance, we've seen 75% reduced TSA wait times using AI in 2025.
Now, contrast that with healthcare, which isn't AI enabled in the same way that air travel is yet. I recently had a family member tear their meniscus, and I was helping them schedule their appointments, and that involved hours and hours on hold and talking to a bunch of different facilities. It was super manual and super frustrating. But what if we could change all of that?
That's why we developed Health Galaxy. So what we have on the left here is a user, and the user wants to access all of these different healthcare systems using their AI tools. However, currently, there's no AI access point to any of these systems, despite a lot of them being already FHIR enabled. And so what Health Galaxy does is it builds an MCP gateway to any one of these systems, allowing you to have a unified access point to be able to access any one of these systems through the rules and tools exposed via MCP. So what's MCP? It stands for Model Context Protocol. In principle, it's just the way that AI communicates with all of these different systems on the server side. And all of this is, of course, leveraging InterSystems IRIS, allowing us to also leverage our high-performance FHIR server. So this leverages both the communication capabilities as well as the storage capabilities of InterSystems IRIS.
So here is the Health Galaxy UI. On the left here, we have a chat interface. In the middle here, it's a 3D graph. That's how we visualize all the Fire MCP servers. And on the right side here, we have a session table that records all the inbound and outbound traffic. First, let's see how to create a new Fire MCP server. You can do it by add a Fire MCP server in like the traditional way, just enter JSON or enter this form, or we can just generate a Fire MCP server from a Fire endpoints. And let's go ahead and generate a server. So what it's doing right now is pulling the capability statement from the Fire endpoints. And as you can see, here's a capability statement JSON. And we can also see the MCP configs, which record all the tools we have and all the authentication details and the permission we have. Now let's confirm and add the Fire server, and boom, we have the new Fire server. Now that we have add a new Fire server, let's see this how everything connects in actions. I would say prepare a complete pre-op assessment for the device's upcoming new surgery, and you will see how the agent is thinking, collecting data for different sources. Everything is visualized here in a middle graph, and then doing actions, and then complete this report. So it seems like the AI just send the pre-op summary to the provider, and then let's take a look at this right line here.
And that right there is pretty important because a lot of AI tools is missing this part, which is governance, like what data is being sent to the AI model and which data is being accessed. Here we see an error. It says that there is an insufficient permission for this data from primary clinic, which is from Epic. And from this tool, we would be able to visualize which error exactly it is. And by clicking it, we would be able to know the details, which specific hospital this is from, and in real world how this is helpful. This is helpful in a way when a hospital or someone want to know which clinicians accessed which patient data, and it's all observable within this UI, which also directly connects to our iris trace as well.
And as Vishal mentioned, all of this data is stored within Iris's highly performant database as an end-to-end visual trace that shows you the full life cycle of all these interactions happening via the MCP protocol. And what's important to note here is not only are we able to use MCP to access FHIR data for the agent, we're also able to take action on that data. As we can see through this visual trace, we're hitting some MCP tools that are allowing us to do things like schedule an appointment with that information or look up a patient's insurance information to see if services are in network.
We just saw agentic access. So the ability to AI enable any healthcare application. Using that MCP gateway, you are able to facilitate AI calls to any one of these healthcare systems through that one MCP gateway. And all of what you just saw was done in a minimal amount of time with minimal experience required to be able to facilitate these connections. So we are able to turn that capability statement into an MCP with just a button click, being able to leverage that to make all those different calls. And then since we are leveraging FHIR, that means we have unified storage and exchange, being able to leverage both the storage capabilities and the exchange capabilities of Iris as well.
Now, throughout the industry, there's rapid standardization on FHIR as hospitals, health plans, EMRs, startups alike have all started using FHIR to exchange data. And on top of that, they're leveraging FHIR to store their data and run analytics, build applications, and more. So FHIR is really taking over the healthcare industry.
Meanwhile, AI agents are booming, but there is a missing piece. That's the bridge between this healthcare data and intelligent actions.
And that's where Health Galaxy comes in. We're filling in the missing layer between AI agents, which are unable to access healthcare data, and providing them with access to these FHIR resources that are easy for machines to parse. And that means we are enabling all of healthcare data by sharing all of that FHIR data with these agents.